COVID-19 cases still on the rise. The private sector is ramping up efforts to help contain the virus. Recently, the Project Ark initiative teamed up with local governments in Metro Manila to help test more people. Let's find out more from Doctor Minguita Padilla, the project's medical team leader. Dr. Padilla, thank you so much for joining us on The Final Word. To date, Project Ark has tested how many individuals from private companies and the local government units?
Good evening, Rico, and to everybody watching. Well, from private companies, an estimated 800,000 have been tested. And this is just from private companies. Although we have about 1,900,000 tests. These are rapid test kits. And the companies who are members of Project Ark do their tests every 2 weeks, okay? It's not just a one-shot deal. It's to monitor also their employees.
So, Dr. Padilla, what did the initial results say from the first batch?
Okay, the first batch, we found that a lot of asymptomatics, there are about 2.7% of asymptomatics who are actually reactive. In other words, they had already antibodies. Many of them had previous infection. Some had present infection. And we were able to isolate them immediately. And it has helped the companies actually keep their workplaces safe. As far as the LGUs are concerned, Manila was our first LGU, Sampaloc, then Tondo, then Quezon City. We have about 40 LGUs, Rico, who have already been part of Project Ark, about 7.6% reactive. And these are in the asymptomatics. So no matter what you say, we were able to isolate these people and quarantine them and prevent further infection. Okay?
And what is the plan going forward, Dr. Padilla? What is your target number of tests?
Actually, our target is not just antibody testing and not rapid antibody testing. We just want to make it clear, we had to embark on rapid antibody testing because we had nothing. We had minuscule PCR capacity. So we had to do this in conjunction or together with the limited PCR, okay? So we were able to come up with a protocol. Now, there's an increased capacity for PCR, but there's underutilization. And we, in Project Ark, actually put up 10 PCR laboratories, so we were able to bring down the price to like 1,100 per test, from a high of 8,000 in some places, 1,100 for those who are symptomatics or those who really are in the expanded list, and 1,900 for the asymptomatics. This is a very big thing. Right. We're just hoping that, so we have 10 of these, and then we also have an initiative for pooled PCR testing.
What is the pooled PCR testing, Dr. Padilla?
Okay, pooled PCR testing is, for example, now you have a factory, you want to monitor. And then you think that the infection rate is not that high, but you don't know because many are asymptomatic. You pool maybe 10 people, you swab 10 swabs, 10 of them into one test. So instead of doing one test per person, you can do one test per 10. If it comes out negative, you presume that all of those people are negative. So it saves you a lot of money, a lot of effort. If it comes out positive, you can divide it into 2 batches. If there's still a positive there, that's the only time you will test each one positive. This is not rocket science, Rico. It was used in World War II to screen soldiers for syphilis in the U.S. military. It was used for the HIV epidemic in the 1990s. It's being used in Israel, in Germany, and Wuhan used this method to be able to test 10 million people in less than 2 weeks.
So, Doctor, when will you be rolling out this pooled testing initiative?
Well, we have to do first some tests because the DOH tells us we have to first do some tests in 2 hospitals, okay? We're waiting for the IRB, the Institutional Review Board, to give us the go signal, and hopefully it will come next week. And then after that, the 2 hospitals will be the Philippine Children's Hospital and the Perpetual Health Hospital. This is another thing, Rico. We are hoping for a greater sense of urgency on the part of the Department of Health, so they can speed up all these permits that we have to get from them.
Why is there so much bureaucracy with the government and the Department of Health? Why can we not speed up the process? Because we need to continue testing. It's about test.
Yeah, test. Because all these lockdowns are useless if we don't do massive testing. And this initiative for pool testing is a way. In fact, the U.S. is thinking of doing it because they're in a desperate situation also, worse than us. We're hoping. I think it's like a mindset of a bureaucratic mindset which has to change, Rico, because we are in a crisis situation. That's been our cry from the very start. We need a greater sense of urgency I know some of the government officials, like those in the T3, in the IATF, like the group of Vince Dixon, they have a sense of urgency. They're working with us. But there are others in the bureaucracy who are lackadaisical and still doing things the way they usually
So,
do
Dr.
it.
Padilla, what is on your wish list? So at least we see a closer partnership between the private sector and the public sector.
Okay, one is okay. We agree we cannot afford a general lockdown. Our economy will suffer. Our people will go hungry. But if this the R naught keeps going up, we have to do a more like pocket lockdowns. Then if still it doesn't work, that's the only time we do a general lockdown. We need them to have a greater sense of urgency. We need more an expanded group of testing so that a lot more frontliners such as the beauty parlor attendants, the drivers who are asymptomatic can have free tests. They don't have to pay for it because what keeps the people from being tested is they have to pay for it. Mahal. No?
Yes.
Okay. If it's free, they will go. They're not afraid. They will go because it's for their own good, for their family. So we have to expand the testing. And then we have to, aside from that, don't look at us private sector as interlopers. Really look at us as partners because we are really partners. We're spending and we're just pushing more because we really want things to happen. No? And then, so expand the testing group, give it for free, do pooled testing. You do pooled antibody testing, then pooled PCR testing every 3 months, antibody testing every 2 weeks. You will cover about 98% of the virus-infected population. And finally, we want to see that this is me, I'm talking as myself, but I think I'm talking for many people, a president to say, lay off health. Seriously, lay off health. Everybody who's thinking of health for profiteering, not just profit, but profiteering, those who look at health as for pogi points, for political ambition, stop. It should only be for public welfare. Tama na ito. Tama na yung turf wars. Tama na yung, teka, wala pa akong profit dito. Can I earn more? Stop the profiteering. Stop the pogi points race. And stop the turf wars about health. Let it all be just for public welfare. And that's really what we want to see and what we hear. Lay off health. I wish our president would say that and everybody would just do it. For the next 2 years, in fact. Otherwise, it's going to be really, really difficult for us.
I do hope the president is listening to what Dr. Minguita Padilla is saying right now. Thank you so much for joining us on The Final Word, Dr. Minguita Padilla, Project Ark Medical Team Leader.
Thank you.